Hey, welcome to my channel. My name's Marion McRae. I'm a physiotherapist and back pain specialist and founder of the Bulletproof Backs methodology. If you're here, it's because you're ready to take charge of your back pain, I hope, and discover a holistic path to healing, one that combines mindset, movement, emotional fitness, and lifestyle strategy. This particular section I call Ask the Back Pain Coach, and I hope to answer your most pressing back pain questions straight from the heart and backed by nearly 28 years of experience now. I always am amazed at how your question is really providing answers for many others. So don't be shy. Reach out and hit me with what you've got, and I can only offer you my heartfelt ideas. Before we dive in, a quick note that the information I share here reflects my own personal opinions only, and it draws from my experience as a physio. It's meant for educational purposes and it isn't a substitute for advice from your own healthcare team. I encourage you to consult your doctor, your therapist to tailor these ideas to your unique situation. With that being said, let's get started. Hopefully, this is the first step in building your own bulletproof back. Today, we have a question from Clara. It goes, Hi, my name is Clara and I'm from Toronto. Man, I love Canada. I want to get there. My kids rave about, well, we all want to go to Canada for some reason. Um, I've had back pain since last year when I started caring for my aging parents. Oh. The doctor mentioned it might be a muscle imbalance from all the lifting, but I'm too busy to see a physio regularly. My pain is getting worse, and now I'm having trouble sleeping, which makes me more irritable with my family. A friend who knows what I'm going through shared one of your podcasts, and it really hit home for me. I've been following your channel and would love your tips for someone in my situation. These questions just, I get emotional every time. I think because I feel your struggle, and I totally get how tricky it is when you've got demands on you. You know, internally you're struggling, but you feel like you've got these people relying on you that you have to keep going for. It is, excuse me, itchy nose. It, I don't know. I think it's part of life. There's a time to be struggling in life, and often our backs show up when we are. But yeah, Clara, I just want you to know that you are in a challenging situation, and I'll give you the best I can give you. Um, let's start with the doctor thinking it might be a muscle imbalance from all the lifting. Are you lifting lots? If you are, then there's probably two options that I can think of. One, maybe getting an occupational therapist in to give you some equipment that may help with the transfers of your elderly parents, or give them tools where they can pull themselves into positions more than relying on you. So, transferring of aged people can take a physical toll on the person transferring them without that person having any sort of manual handling training or any of the equipment out there in place, which might be of use. So I think getting the advice of an occupational therapist to come and visit your home and to give you some really great coaching on what part of the transference, frames, bed sticks, bed sheets, hoists, God forbid, depending on their level of mobility, would be all the sort of the equipment ideas that an occupational therapist might be able to assist with. And also, they can coach you into some ideas they might have about how to minimize the physical stress on your body by transferring your parents or, getting home help in or whatever's got to happen. You cannot keep, well, you can, but you're going to blow a gasket and then who have your parents got? So, from a very practical point of view, you can't go down with them. They can't afford for you to go down. You have to prioritize you staying afloat. so that you can continue to be what you want to be for them. So this is not selfish. This is pure, smart survival for three people. You getting what you need so that you can keep being what you want to be for them. Beyond that, second choice that I see is, somehow you try and get stronger, or it might be you do a bit of both. You minimize the load transference and you up the strength in your own body to help you transfer. Getting stronger when you're time pressured and not feeling great is always challenging. I think if your body's under stress and then you start adding weights to the situation, it sometimes can backfire. But we could keep it simple. You could start with just, 10 squats, 10 push-ups. That's it. Do that every few hours. If it's feeling like it's stimulating some muscles and it's within your range and you're coping with it, but you feel it's stressing the system a little bit, but not too much, might be that you start with 5 push-ups, 5 squats, and you do that every third hour. And then by the end of the day, you've done 10. Where you start is irrelevant. It's the habit that's important. And that is very time efficient. 5 minutes tops, 3 5-minute strength hits per day. And I've chosen push-ups and squats because squats will take care of your lower body, push-ups will take care of your core and your upper body. So for transferring elderly parents, that's about as simple as it gets. And that possibly won't feel too overwhelming for you to add in. It might be quite practical. And that will start to get you a bit stronger. So if they can start transferring themselves a bit more and you can start to get a little bit stronger, then you're narrowing the gap there and you're hopefully finding a bit more of a sustainable pathway for yourself. A few other things that come up for me. I don't think you can get a muscle imbalance from lifting people too much. I think you could maybe get a muscle strain, but imbalance refers to the fact that some muscles are tighter than others and the alignment of your spine is affected by the imbalance of the forces of those muscles on key bones like your iliums or pelvis and spinal muscles. So my vibe would be, your back is giving you some really solid feedback that you are overworked, under-supported, and we need to reverse that. So the 2 tips I'm starting with is the occupational therapy advice. You physically starting to physically build a bit more physical capacity so that you feel a little bit stronger managing these transfers. And the third part would be to practice feeling supported. When you're feeling under-supported, it becomes a feeling of overwhelm, which is our nervous system adapts to the feelings it encounters most often. It's a really interesting thing. And I'm with you here, Clara, on the overwhelm feeling. It's definitely my emotion, my personal emotional addiction is overwhelm. I feel really great most of the time, but when I don't feel great, the emotion that gets me frequently is that feeling of overwhelm. And what I've learned helps me and may help you is to lay down on something hard. Usually I just crave laying on the earth. I'm a bit of a hippie, so I love the barefoot, flat on the grass under a tree feeling. Sometimes if I can't get that, I will find a nice solid high-backed chair that I can sit into and feel it support the whole of my back and my head if possible. Definitely through my lower thighs, my feet on the earth. And I would just feel what it's like to feel support, to feel something pressing and holding me. And I remind myself that that's a feeling that I desire and that I just need to remind myself I can access it at any time by feeling it. And if I remind my body what it's like to feel supported, then what I normally observe is support comes from all sorts of places. It might be from a friend offering to do something for me. It might be from my beautiful partner, saying, how about I do that for you? It could be even, God forbid, my kids. Mum, would you like that? Oh my God, that's like magic. So I think reminding yourself of the feeling of support will invite more support into your reality. And you want to be able to care for these parents without resentment. You want to know that you're choosing this because you love them and you choose to care for them in their age. But if it's depleting you, you'll end up resenting it and you'll snap at them because it's not coming from a place of overflowing love and fulfillment. It's coming from a depleted sense of I'm exhausted, I'm overwhelmed, and I've got these people to care for. It's a very different energy stream. So if you can remind yourself you're choosing to do this because you love them, and you don't have to choose to do all of it for them. You could choose to do the bits that feel right for you that don't deplete you, and then you can ask for support and receive support from whatever else is out there that you can combine with your own level of what you can offer. I think that's probably the best place. I hope that helps. As you can see by now with these questions, the answers I give are very different for each person. There's no one way. There's so many variables, so many factors. People's situations are so unique. And for me to say to someone like Clara, oh, you need to do this exercise five, like, and these, oh, fuck, that doesn't help her. That's not her situation. There's so many more factors involved in her back pain than here's 7 exercises to strengthen your core. I guess that's the whole point of these answers, is just to demonstrate that in real time that managing back pain, finding relief from back pain, and eventually believing you can be free of it is very different for every single person in it. And yeah, I hope that's enough for you to shift your perspective in some way. And I appreciate all of you who take the time to reach out and offer your questions, because when I speak to one of you, I'm sure I speak to many more. Thank you. I'll see you next time.